chat. I'm to all panelists and
Hello, and thank you for joining us. I'd like to welcome everyone to the AAHI MENA webinar. Today's webinar on building capacity for clinical research in an academic health center will be presented by Dr. Elie Akl. Dr. Akl is a tenured professor of medicine at the American University of Beirut. He leads the Division of General Internal Medicine and Geriatrics at ABMC and directs the Clinical Research Institute and the EB Grade Center. He has a part-time appointment in the Department of Health Research Methods, Evidence, and Impact at McMaster University. His research expertise is in systematic review, practice guidelines, and conflict of interest. He serves as a guideline methodologist for a number of North American professional organizations and the World Health Organization, WHO. He published more than 360 peer-reviewed papers and was listed by Thomson Reuters as one of the 2015 world's most influential scientific minds and as one of the highly cited researchers yearly since 2015. Please feel free to submit questions at any time during the session using the chat feature on your screen. Dr. Akl will be answering your questions at the end of the webinar during the Q&A. Thanks again for joining us today. I'd like to welcome Dr. Akl. Dr. Akl, go ahead.
Pleasure to be here and to be presenting the first of a series of presentation by AAHCI on dynamics of research in academic health centers. So my presentation today is about building the capacity for clinical research in an academic health center. I will be building on the example of the Clinical Research Institute at the American University of Beirut. So I will start with the presentation, and at the end we'll have a Q&A session. So in terms of the disclosures, I have no financial relationships of interest to declare. My main disclosure is that I serve as the director of the Clinical Research Institute. So this is my outline. I'll start with a brief presentation about medical research at AUB. And then I'll talk about building capacity first in the context of the Clinical Research Institute, but then I'll try to expand a little bit to look at the bigger picture. So since its establishment in 1867, AUB and the Faculty of Medicine had research as part of its core mission. A couple of years ago, we celebrated our 150th anniversary, and for the occasion, we conducted this bibliometric analysis to look at the publication in medical research in the Arab world. To illustrate some of the involvement of AUB in research, you can see in this table that among the top universities in the Arab world, and if you look at before the last column, AUB contributed 63% of research at the national level, which compares favorably with other universities. The top university actually was Kuwait University that contributed 65% of medical research in Kuwait. If you look at the last column, which is the citation per paper, this is an indicator of the quality of research. And AUB topped the list with 13.8 citation per paper. Some more indicators in this next table where we looked at the percentage of paper in the top quartile journal and top 10%. Under top quartile journal, 36% of papers published by AUB faculty were published in Q1 journals, and that was the highest in the list. 12.7% of those papers were published in the top 10% journal, which is second in the list. When we tried to look at more recent numbers, so actually today I asked the help of my colleague, Dr. Luqman Mahfou from the university libraries, and these are the numbers of publications from AUB faculty over the last 10 years. You will see that the numbers started at 230 in 2009, and last year we got to 574 publications, which is a 2.5-fold increase, so actually 150% increase in the number of publications. So I'm showing you these slides to illustrate the prominence that AUB has gained in terms of medical research publication over the last 10 years. This is the number of publication per faculty. We wanted to account for the number of, for the increased number of faculty, because one could assume that the number of publication has increased simply because of the increase in the number of faculty. Although we had an increased number of faculty from 169 to about 307 faculty over the same period, the number of publication per faculty went from 136 to 1.36 to 1.87, which is a 40% increase. So again, I wanted to illustrate this increase in publication rate to get to our subject, which is building the capacity and starting with the Clinical Research Institute. The one point I missed to highlight is that we have witnessed over the last 10 years a real commitment and investment from the leadership of the Faculty of Medicine and the Medical Center in clinical research. And this is being illustrated first by the Clinical Research Institute. So the Institute was established in 2010 to provide the required infrastructure, support and promote innovative clinical research and collaborative activities, the Faculty of Medicine and at the Medical Center. So this is our organizational chart that shows that we report to the Dean of the Faculty of Medicine through the Associate Dean for Translation and Clinical Research. You will see that we have one major center. I will briefly describe that. But we have a number of units that provide services and support. That's in the middle, the list in the middle. And we have a number of programs that provide capacity building for different groups at our university. So starting with the first unit is the clinical research unit. It's supposed to conduct of clinical research through providing space and nursing services to our faculty. So faculty who have either sponsored research or investigator-initiated research, they can take advantage of this service. What we're trying to do at this point is to offer more research coordination for those projects and be more responsive to the needs by having a mobile CRU. The next unit is the research education unit. This is one of the most active units. We provide a long list of training workshops. Up to last year, we ran about 41 workshops. We have participants from AUB outside Lebanon and other universities outside Lebanon and from abroad. And we do deliver some of these workshops based on invitation. A couple of pictures, but more importantly, the list of workshops. You will see from this list that we cover a wide range of topics, going from the very quantitative kind of workshops with statistical analysis to qualitative workshop, but also some of the soft skills with medical writing, publishing workshops, etc. In terms of specific groups that we try to support, the first one is residents and clinical fellows. So there is a requirement of the last few years for everyone in clinical training to deliver a research project by the time of their publication. As I mentioned, this is a requirement. So far, we've graduated 540 residents. What we provide through this program is a coordination where we try to coordinate between the resident, the mentor, and the program. We have a dedicated portal for that. We provide training sessions, about 14 sessions per year that residents can attend. We do provide methodological support when they need help. They come in, they show up to our offices, and we provide that support. Also importantly, we give the opportunity to present either oral or poster presentations during our open house and some other events, and we provide awards and certificates. So far, again, this is up to last academic year, participants in this program have published a total of 58 peer-reviewed publications. And this is the list of sessions we provide them with that cover, again, different types of research design, different kind of skills in terms of literature search, analysis, statistics. The next program is kind of a similar program, but this time is focused on the undergraduate students. So these are mainly pre-med students who are interested in working with medical faculty. So far we have matched 120 students with clinical and other faculty, the Faculty of Medicine. So what the program provides is, again, matching the volunteers with the faculty, depending on the interest. We use a portal for that. We provide them with 4 training sessions. Remember, these are undergraduate students, so they don't have much of medical or even research background. So these are more basic training sessions. We do follow up with them to make sure they are satisfied that things are progressing well. And in some cases, we have to change their placement to make sure they are getting the experience they are expecting. Again, opportunity to present and to receive awards at the end of the year. So far, these undergraduate students have published 16 papers. In many cases, they might be leading on some of those papers. So a couple of pictures to illustrate the sessions where we introduce research, some of the awards. There's like a 1,000 cash award. Okay, the next program is the Research Personnel Program. So this is now targeting research fellows. So it's not clinical fellows. So these are typically MDs who are in transition, awaiting research positions and research assistants. So this is a one-year program that could be extended to 2 years. In this case, we call it the postdoctoral program, mainly with research fellows, MDs, and PhDs. So in addition to the 2-year commitment, they get more closer follow-up in terms of a research project they have to deliver and regular sessions where they attend and discuss their projects and their progress. In terms of the curriculum for these 2 programs, we have 2 tracks, a clinical track and a basic sciences track. We provide many workshops at the beginning of the academic year, which is mainly the summer. And for the rest of the year, we have a seminar series, and we provide them with the opportunity to attend our training workshops. So this is the list of mini workshops we run during the summer, and we do it during the summer because this is when typically everyone joins, and we want to make sure that they get the skills they need to have a productive year. So they go from ethics to consenting, literature search, to manuscript writing and authorship. And you will see from the list that we have dedicated sessions for basic sciences and other dedicated sessions for the clinical track. So now we move to a different program. It's called the Faculty Advancement Program. As the name suggests, is for new faculty joining our Faculty of Medicine and the Medical Center. So we've had 48 participants so far, and the program includes bi-monthly seminar series. So twice per month, the faculty join us where we give them seminars about different topics. They can have the opportunity to attend the training workshop. They are expected to develop an integrated project, which is mainly a proposal for a project they would like to, a research project would like to implement. And by the end of the year, there are awards and certificates. More importantly, this is a prerequisite for what we call the seed fund. So each one of those new faculty get a non-competitive type of grant based on the precondition being that they go through this program and develop a well-framed proposal. What we offer through this program is not just the sessions that I'm listing here, but also close mentorship. Each 3 to 4 faculty are assigned to a mentor, ideally from their specialty, to provide them with the content expertise, in addition to the methodological expertise that we provide at the CRI. So you will see here that most of these sessions are about the soft skills that we would like them to acquire, like how does the IRB work, how to get through IRB, which is the Institutional Review Board, how to prepare for your promotion, how to peer review a paper, building a research program, etc. We have started a similar program for nurses called the Nursing Advancement Program. It targets our registered nurses at the medical center who have a master's degree. Again, these are not, so we do have a school of nursing, but these are specifically the practicing nurses on the floors who are interested in conducting research. We have weekly seminars, they can attend training workshops. We help them with developing their own proposal, and then at the end of the year, we have awards and certificates. So this is the kind of sessions that they get. You will see by now that there's some overlap in terms of the sessions or the topics with other programs, but each of these programs get different sessions because we tailor the presentation and the delivery of the topic to the type of group and to their level. So this is a chart trying to summarize the different programs we deliver. And I've added at the bottom 2 important programs that are part of, that are being delivered in our Faculty of Medicine, which are SHARP, the Scholars in Health Research Program, a master's degree focusing on NCDs, and a new program called the Scholarly Concentration Program focusing on medical students. So if you go to the top row, you will see that almost every type of groups within the Faculty of Medicine is getting exposed to at least one program, from pre-med to medical students, residents, fellow, faculty, research fellow nurses, research assistant, and clinical research coordinator. So the joke that goes around is that next we'll be developing a program for the janitors at AUMC. Okay, review of a couple of brief centers and programs we also run. The AUB Great Center is specialized in development of guidelines. We support our faculty in their efforts to develop clinical practice guidelines, but we do also provide external support for organizations like the World Health Organization, ministries in the Arab world. We provided support to Ministry of Health in Saudi Arabia, Ministry of Health in Tunisia. We provide support for societies in Europe and North America, like the American Society of Hematology and the American College of Rheumatology. And lately we've had the European CDC in some of their projects. Another major initiative that we have the pleasure to host at AUB and at the CRI is called the Global Evidence Synthesis Initiative. As the name suggests, intended to support countries in low and middle income countries in developing systematic reviews. We are supporting about 47 centers all over the world, and as you can see in the map. What we've tried to do in achieving or in conducting those programs is to follow an evidence-based approach. One example here is at one point we had a suggestion to support faculty in creating social media account to enhance dissemination of their research. So what we've done, we conducted a systematic review of the literature on the topic. So this is a study that is hopefully about to be published soon. We're using the results of that systematic review to try to support faculty in that regard. We have conducted formal evaluation assessment for most of our programs, conducting surveys and qualitative research. I mentioned the MRVP, the FRP, the RPP. With all these programs, conducted one of those studies. What these studies have done, particularly the qualitative studies, they have given us insight about the challenges and the opportunities to improve the design and the delivery of the programs. What they have also done, they have given the opportunity to our staff to develop, so I'm talking about the CRI staff, to develop their research skills and get the opportunity to publish these studies. Another example is developing a framework for building research collaborations. So we're doing a systematic review on the topic that is about to be completed. The trigger for this concept was when we conducted the bibliometric analysis that I mentioned earlier. We found that the number of publications per paper was much higher for papers that reflected collaboration between different institutions, between Lebanon and the Arab world, and between Lebanon and other countries, like in Europe and the US. So this is how we had the concept that we need to encourage and support research collaboration. And as I mentioned, we're doing the systematic review to come up with a framework to develop such collaborations. One point about our projects or our programs that I haven't mentioned is that we try to ensure quality by having quality assurance and quality improvement initiatives as part of those programs. And by having standardized approaches to developing the workshops, for example, by having a checklist and standard material. What we try to do is also harness the resources. So the number of our faculty is relatively limited. So we have 3 full-time faculty in the center. So we figured that the best way to move forward is to try to take advantage of the faculty or members that we have within AUBMC. Many of those are well-trained in research with good background and good track record of publication and capacity building. So we've asked them to join us as what we call affiliate faculty. We have affiliate faculty from different departments, the Department of Surgery, the Department of Internal Medicine. We also have someone from Basic Sciences and even a professor from outside the Faculty of Medicine who helps us with the medical research volunteer program. That was the part about the Clinical Research Institute. So now I'll move to talk a little bit about the bigger picture in terms of capacity building and supporting capacity for medical research. The first point I would like to touch upon is the funding. We have a number of internal funding streams. The main one is the medical practice plan, also known as the MPP. So this is referring to the practice plan of our faculty. So the money is coming from clinical income, and part of it is dedicated to for research purposes. And the number, and I'll show you shortly on the next slide, the number or the amount of this funding has been increasing steadily over the last 10 years since Dean Sayegh took over the deanship of the Faculty of Medicine. As I mentioned earlier, there was a major investment in research, and part of it, in addition to the CRI, was ensuring there's adequate funding for faculty. So the MPP is on a competitive basis, so faculty apply. The applications go through a peer review process. We invite peer reviewers from outside Lebanon, international experts in the field to review the grant, and we try to have as much structured and transparent process as possible. And then there's the seed grant. This one, as I mentioned earlier, is not competitive. So faculty have to go through our FAP, deliver a well-designed proposal, and they get the seed grant. The other funding schemes that are also internal schemes were built to encourage collaboration. You will see a list of those. Farouk Jabr for interfaculty research grants, the CRS grants, interdisciplinary grants. And then there's this joint, the third one, USG AUB Healthcare Innovation Technology Stimulus HITS, that is intended to encourage collaboration between our university and another university in Lebanon. So in terms of the external funding, so that's what we ask faculty to do is after they apply for the internal grants like the MPP, they are expected to apply for external grants as a condition to reapply for the MPP, hoping that this will encourage them to do that. Although this, as you probably know, the external funds in the region are relatively limited. Going back to the internal funding, you will see that over the last 9 years, 9 to 10 years, the numbers have gone from 600,000 US dollars to about 1,800 or 1,800,000 US dollars. So the numbers have tripled over the last 9 or 10 years. Again, showing the commitment of the leadership to advancing research within the Faculty of Medicine. And the other important part in terms of the support of the leadership is the building of new core facilities for basic sciences, but also for other centers like Genomic Center, Center for Excellence in Cancer and Neurosciences. The building you'll see in the bottom of the screen is what's called the ACC building, the Academic and Clinical Center, that was inaugurated a couple of years ago, and this is where the CRI sit on the 3rd floor. But this is also showing the commitment to to support the different centers of excellence. I wanted to get to the point of discussing the current challenges. As you know, Lebanon is currently facing both financial and economic crises, and these have had impact on the functioning of the CRI in different ways. One of the obvious ways has been the inability of our target audience to pay the fees for our workshops. And what we've done is that we have decided to cut down significantly our fees, encourage people to participate, because the mission of the CRI has been to advance research without worrying too much about money. So we've cut on these expenses and fees and hoping to attract our target audience to participate in those workshops. I've already mentioned the scarce funding resources. Unfortunately, they are becoming more scarce with the different crises we are facing in the region. I guess the most important part of why we've seen the success of our programs is that we take the time to celebrate our successes. We have two major opportunities to do that. The first one is the annual Biomedical Research Day, which is a campus-wide event that attracts all kinds of biomedical research. And the other one is the annual Clinical Research Open House. So this one is more focused on clinical research, and where the Clinical Research Institute, the CRI, plays a role in organizing and delivering the event. So these are some pictures from the event where we give the opportunity of participants in our different programs to do oral and poster presentations, and at the end we have awards and certificates for those participants. So I will close now with a short video on the CRI, and after that we'll move to take questions, comments.
for attending this webinar. If you have any questions, please let us know using the chat feature on your desktop. Let us know if you have any please let me know if you are hearing me.
Does anyone have any question? Okay, thank you everyone for attending, and please feel free to email us if you have any questions, or it would be better to visit and we can meet and discuss. Thank you.